What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now in this video, we're going to talk about how to be an amazing intern. How are you going to dominate your first year of residency? Well, it's simple. You work. That doesn't mean you just try hard. You gotta work strategically. You gotta put the effort where it counts. You gotta isolate what makes a good intern, what are intern responsibilities, and make sure you do those very well. So I'm a PGY2. I've already finished my intern year. I was fortunate enough to win Intern of the Year. I just worked hard and cleverly, I think, which is how I think I got the award. But winning Intern of the Year or just being a good intern, all that means is you understand what you're supposed to do and you just try to accomplish that task. So here's what you do. What is the point of internship really? The first year of residency, and this is my biased and never humble opinion as always, is designed so that you learn really the basics of management in real life of patients. So as the intern, your responsibilities are quite simple. When a patient is coming onto the service or you're being consulted in the ED, your job is to assess the patient, it's to come up with an assessment plan, do the initial exam, put in the orders, staff it with your attending, put in all the admit orders if you're going to admit the person, make sure everything happens seamlessly along that process, make sure you put all the orders in correctly, deal with nursing and other staff that have questions regarding the patient's management, you didn't put this order right, hey, I need restraints, you forgot to replete the K, etc., etc. Your job is to make sure all that happens seamlessly. Now, the core of that is that kind of what you're doing to a large degree could be seen as like grunt work, or some people even call it scut work. I don't think it's scut or grunt work. I instead think it's you learning how to do everything that's like the fundamental stuff that needs to be done for a patient after they arrive to a hospital. You see them, you assess them, you decide if they need to be admitted, and if they do, you put in all the orders and take all the necessary steps so they seamlessly get admitted, they get managed by the appropriate people or any kind of consults you need, they get the right care, they get proper discharge and dispo planning and set up, and then they get discharged. To make sure all that happens seamlessly is something that's really important to learn as like an attending that works. If you work in private practice or in the community, you're not going to have an intern. For the most part, someone's going to admit. If you're medicine, it's probably you, or if you're a consultant, medicine will probably admit for you, and then you'll be consulted, you'll see the patient, or medicine will admit and manage them and then call you on as a consultant. People will be working, nurses will have questions, they'll be paging you, discharge will come up, dispo, talking with social work and case management. This is all part of normal life. This is not like unique to being an intern. So you need to learn these basic skills that are required to get the work of patient care done. Getting, if the patient's there in the hospital, if necessary admit, take care of them the whole time they're there, and then properly discharge. Those are like the core essentials of doctoring, and that's what intern year teaches you. Now, to be a really good intern, let's go through like a really simple day. Let's say you're just like on the inpatient service, not ICU, make it kind of simple. You get there in the morning for sign out, the overnight team's going to sign out to you. If you have any admissions, maybe you're on call that day or a non-call day, if you happen to be in medicine, you get those days. If you're a consultant like me, every day's call day. You don't get to, relax. But, whatever came in overnight, you talk about, you go in, you kind of see all your patients, you pre-round, your senior comes in, you talk to him or her, you go see all the patients, you get ready for rounds, talk to your senior again about things you saw or plans or ideas you have, dispo planning. You go with your attending, you round, you staff, you do however your program has it done. You go round table, bedside, however your attending likes to do it. And then once rounds are done, that's when, the second phase of being a really strong intern comes into play. So we'll separate it into two. One is all the work you did before rounds, and the next work will be all the work you do after rounds. So before, you coming in early, seeing the patients, reviewing the labs, doing all the exams, coming up with modified assessment and plans for all the patients, or like planning discharge. That's the core stuff you need to have managed. And then those are things you talk about with your senior, like, hey man, this lady came in for like a UTI, she had some metabolic encephalopathy from it, we gave her antibiotic treatment, she's doing great, she no longer needs like IV, we can discharge her on a PO course. She happens to be homeless though, but social work or case management have this planned out, she's been cleared by PTOT. Like, you've already thought about all these things, and that's what makes a really good intern. The more work you do is the less work your senior or attending has to do. Theoretically, your attending should be doing zero work, just like high-level management, and you and the senior run the entire service. And the more work you can do, the more senior your senior can be, the more they can be like attending and manage, and then you run the entire show. The more you run the entire show, the better you are as an intern. But forget like trying to be a good intern or making seniors or attending happy. Forget that. Worry about yourself. The better intern you are, the easier your life's gonna be. The harder you work intern year at learning the pathways of how patient care goes, the sooner you can develop ideas on how to make it more efficient, how to have like dot phrases in the computer, how to kind of play the system so it's easier for everyone and also easier on you. So working hard, really don't worry about like, oh, I want to get like an award at graduation, or I want to make my senior or attending happy. Yeah, that's fine. But end of the day, also take care of yourself. Make sure you know what you're doing and making yourself a better intern. Now, so that's all pre-round stuff. Plan essentially everything. What a senior normally would do is kind of quickly see the patients and then just think about plan and dispo while you do everything else. The more you can get that figured out, the better you're going to be. And then during rounds, obviously present strong, know your patients well. You're going to get pimped on questions, whatever, it's part of life. Do your best. I don't even worry about that. Just do your best, you'll learn stuff as time goes on. Here's the thing where I think a lot of people get kind of stuck on, which is thinking that as an intern, you gotta know everything. That's not true. No one cares whether or not you know stuff. People care whether or not you're trying. Remember, intern year and residency in general is just work. So we want to make sure you're working. Intern year really is just a lot of physical work of moving patients around and getting the care they need. So at this level, no one cares if you aren't familiar with the most, if it's even really basic things like treating congestive heart failure, knowing what medications to use. Well, if you weren't comfortable with that, hopefully you talked about it with your senior and they kind of guided you to figure out the plan. But if the attending kind of asks you more questions on that and you just don't know, no one's going to care. You just go home and learn it, or they'll tell you, and then, wow, that's what residency training is. You learn management as you take care of patients. But if you're not following up with social work, if you're not planning dispo, if you're not putting in all the necessary orders, if nurses can't get a hold of you, then you've got a huge problem. So get the core work done, and the knowledge will come with it. So don't think intern year is all about, oh man, I gotta learn everything and know all the management. Yeah, you'll learn as you go, but what you really gotta learn is how to get the work done so nothing gets held up. The more efficient you are, the faster the service moves, the faster when patients are coming in, they dispo quicker, there's no holdups. Oh, there's an extra day because so-and-so forgot to put the order in, or they put an order in for like a brain MRI, but then they didn't call radiology, or it just never got done so because the resident didn't push it. Whatever, if your orders aren't getting done and patient care isn't being done efficiently, that looks bad. Now you're not a good intern. But if all your patients are getting the things done, they're like, wow, this guy or girl, they know how to get work done, superb. And now it's the attending and senior's job to kind of help grow your knowledge base, and that's what they'll do. So you do the work, perfect, they'll balance it with making you stronger, and if you're reading too, perfect combo. Here's the one thing I want you to take away as like an ending topic. This is the golden point I don't want you to forget. What really makes a difference in any resident as being a strong or weak is one, yeah, if you're better at management and like admitting patients and you know more, that's better than being that person in the program who doesn't know a lot. It's not good. So know your stuff, and if you can, know a little more. But what really makes a difference is not complaining. Don't complain. I can't tell you how important that is. We all know residency is hard. We all know it's busy. We all know it sucks. Trust me, you as the intern are not like reinventing the, guys, I figured something out, residency, no. We all know it's rough, we all know what it's like. I mean, it's fun, but it's not easy, right? But we signed up for this because it's awesome. We love what we do. So we all know residency isn't a walk in the park, so you're not reinventing the wheel when you complain. Instead, do the opposite. And time again, I'm telling you, say you just pulled, like you just did a 30-hour call, or your night float and you're staffing in the morning. If you can, post-call, seeing patients, be pleasant and nice. If you're coming in the morning and you're just pleasant and nice and not complaining, it makes everyone's life easier. And I can't tell you how important that is. When I was an intern, my chiefs were always like, hey man, thanks for working hard and thanks for not complaining. Because there's lots of other people who are just complaining the days away and you're like, oh God, this is kind of annoying to hear all day. We don't want to hear that. No one wants to hear that. Also, the other part about complaining is it just kind of brings a negative mood. And I can't tell you enough where this just became solid to me because I keep hearing it over and over again. Like after every 30-hour call and you're like there in the morning and you've been up for like a while now, it's like 11 a.m., you're still staffing with the attending, you came into the hospital 6 a.m. the day before, you're still talking about patients, like you didn't get a break. And I remember like one morning my attending came in, really great guy, one of the headache attendings, and like I was there, I was presenting my overnight patients, I was going through the CT scans, and he was like, you know what, Mo, I gotta say, for having worked like as long as you have for the last day straight, I love that you're in a good mood and cheery. And I can't tell him, like that makes perfect sense. Who wants to work with a grumpy bumpy in the morning when you can work with someone who's just like mellow and having fun? I mean, like, be yourself. Like, yeah, does it suck you're tired and you didn't sleep and the ED bothered you and your pager kept going? Sure, but who cares? Nobody cares is my point. What we want is someone who's fun. So yeah, end of the day, like go vent and go talk about it with other people, your family, your friends, go exercise, go manage your stress. But when you're at work with your senior and you're attending, you really, like every now and then complaining is part of life, but like you don't want to be a negative Nancy, you don't want to be someone who's grumpy bumpy, just have fun. Like you can spin it, like when a patient comes in, like all right, this guy, I don't think anything was wrong with him, but he was really funny, let me tell you some of his jokes. He came in for like headache, here's the CT scan. Like just make it more fun. Like you don't have to be like, oh God, this guy, he didn't even need a beat, or ED's always bought. That's not something we want to hear. We want to hear fun, like, you're spinning, get like a good time. All right, here's the conclusion. How are you going to be an intern? Don't complain, okay? Just have fun, try to make the best of it. And that's a good perspective I think you need to have. You signed up for this. This is awesome and fun. Ask anyone who's completed residency and is intending. They love their life. So just kind of tell yourself, I signed up for this. It's only so many years long. I gotta have a positive outlook about it. I'm gonna make the best I can. I signed up for it, so I'm gonna be happy going to work. I'm gonna be like, hey, I'm gonna have fun. I'm gonna learn stuff. I'm gonna talk to people. Make it spin positive for yourself. Next, make sure you do the core work. Don't get caught up on, oh, I'm just going to ignore orders and notes for a while and let it pile up and instead I'm going to read. That doesn't fly. You have to get your work done first. You need to be efficient, get all your orders in, get all your notes written. You are the machine that makes the program and the residency and the teamwork. You as the intern are like the gears in the oil. So get all your work done and then everything else flows seamlessly. Last point, make your life easier. Look at my hair. This might be the first time you guys saw me with like a kind of very low haircut. I call this my ICU hair because when I'm really busy in the unit, and when I'm up 30 hours, I kind of don't want to have to worry about my poof and my comb when I get up in the morning. This just makes life easier. So a way to cope with being busy in residency, make your life simpler. What do? I wear scrubs every day. My program's cool with it, so I'm lucky. But I just have a lot of scrubs. They're always washed. I have like a day where I wash all my scrubs again. My white coat's laundered at the hospital. I'm lucky there. If not, you can just throw it in with your scrubs. Like set up routines for yourself to make things more simple. Reduce the complexity. Wear similar things if you want. Eat similar foods, whatever. Makes your life easier, do it. For me, I was getting exhausted with having to always fix my hair when I woke up every morning, like in between calls or overnight. So when I'm on a really busy service, I just trim my hair and make it easy. I wear the same scrubs every day, make it easy. Do whatever you have to do to make these next few years work for you and for you to thrive. Guys, intern year is a blast. It's so much fun. It only gets more fun as residency goes on. You're gonna do well, you're gonna kill it. Any questions, put them down in the comments below. Email me, drop them on the Facebook page, and as always, enjoy your studies.